Good afternoon, everybody, and like the Premier, offer my sympathies and condolences to the family of the individual who passed away recently, most recently at Northwood. We now have 57 Nova Scotians who have died due to COVID-19, an ongoing reminder about the potential serious nature of this virus. We are reporting one new case of COVID-19 today, which brings the total number of confirmed cases in Nova Scotia to 1,045. This new case is associated with the outbreak in Northwood. And so for the first time, we are reporting no new cases outside of Northwood for 2 days in a row. That's good news, continuing our good progress, but we still need to continue to watch that epidemiology unfold over the coming days. But it's certainly a testament to the work that everybody in Nova Scotia has done adhering to public health rules and the work within the healthcare system and folks in public health and our testing colleagues and in the lab and in primary care in our overall strategy. Yesterday, the QE2 lab processed 353 tests. We currently have 8 individuals in hospital, 4 of them in the ICU. 956 people have recovered, and 36,656 Nova Scotians have been tested and received negative results. We continue to have 2 licensed long-term care homes and unlicensed seniors facilities with active cases of COVID-19. One of those is Northwood, their Halifax campus, which has 19 residents and 3 staff still considered to be active cases. Another facility has 1 single resident as an active case. So while we continue to see good signs in our progress, and as we come out of the first wave of COVID-19, it continues to remain important that we detect anybody who may have symptoms of COVID-19, that we test individuals. So again, remind folks that if they have 2 or more, a fever, a new or worsening cough, a headache, runny nose, or sore throat, please, if you have those symptoms, do the online 811 assessment, or if you don't have online ability, phone 811. They'll walk you through any further assessment and testing as necessary. As we have, as we continue to look forward and things look positive, I want people to understand that what our new normal will look like. I know people are really anxious and would love things to get back to they were prior to COVID-19. But until we have high levels of immunity in the population, we have to stay vigilant in fighting this virus. We have to find a new way and adapt to this new normal, which really, we need to think about how we live with COVID-19. Our new normal is not 2019, it's today and moving forward, and how we put things in place that we can live with COVID-19, find appropriate balance with controlling the virus while we reopen our society and our economy. That means we have to continue to practice the personal preventive measures, which I'll outline in a minute, as we reopen. And we also need to, as we reopen the economy and our society, we need to have businesses, community settings, care environments that also support the practice of these personal preventive measures. What are those personal preventive measures? That we need to focus on the importance on hygiene. Frequent good hand washing remains a cornerstone. We need to have focus on what we call cough etiquette. So coughing or sneezing into your sleeve helps prevent the virus from spreading around. Not touching your face, especially if you have unwashed hands, because that's how we infect ourselves. We have virus on our hands, and we put our hands to our eyes, our nose, our mouth. Good cleaning using a disinfectant product, whether it's in public spaces, workplaces, or at our home. Places where hands frequently go need good frequent cleaning with a disinfectant product. We need to continue. Part of our new normal is a different way we interact with each other. Physical distancing will remain part of our new normal. And so we need to find ways that we interact but maintains that level of physical distancing of 6 feet or more where at all possible. We need to look at things like non-essential travel. The virus is spread around, whether it's locally or globally, by people moving. So a part of our new normal is how we actually limit non-essential travel, whether at an international, global level or at a local community level. Closer to home is part of our new normal. We have to understand that if we are unwell, we need to stay home. And I recognize that there are lots and lots of barriers and that many people don't have sick benefits or other reasons why they need to go to work, or they have their kids go to school because they have to go to work. Lots and lots of reasons. So we need to look at this. There's lots of elements to this, but a fundamental principle needs to be that how do we support people that ultimately, if you're unwell, you can stay home until you're feeling better, whether it's school, work, or going out in the community. But certainly when we have choices about whether we can go out or not, if we're not feeling well, we just need to stay home. We need to look at a part of our new normal is how we bring people together in groups, especially large groups. Some of the highest risk kind of settings for spreading COVID-19 and allowing it to spark up again and have a big outbreak is bringing large numbers of people together, especially in indoor environments when they're in close interaction with each other. So our new normal it really has a lot of how we get together socially and for entertainment and other reasons is going to look very different. We need to these measures will need to be in place for the months ahead as we enter into recovery, but it is part of how we live with COVID, find an appropriate level of control that allows us to continue to sustain the recovery of society and the economy. And lastly, I want to talk in detail about masks, because the appropriate use of masks is also part of this, part of these personal protective measures. There's certainly been lots of debate about the general public using masks. The evidence on masks has evolved, and essentially now we're at a place that we weren't several weeks ago because the evidence wasn't there. We weren't clear on the evidence around the ability of people to be asymptomatic spreaders. But now, as science and evidence has evolved, we know that we can say that really that having the public wearing non-medical masks is important, that we focus on non-medical masks, because medical masks need to be preserved for those who are healthcare providers, that when worn properly, non-medical masks can reduce the spread of the virus the same way cough etiquette and hand washing. It's all part of a package. It's important to understand that two things: that wearing a mask doesn't protect you. It protects people around you because it limits any germs or virus that you have if you cough or sneeze, or even if you're breathing. But masks also need to be worn properly. They need to be fitted so they feel comfortable. They allow you to breathe easily, but actually they need to fit securely over your mouth and nose. And it has to be mouth and nose. I've seen lots of pictures of examples of people, they pull the mask down so it's only over their mouth, it's not over their nose. Or they pull the mask aside. I've seen pictures of people eating or smoking a cigarette, pulling the mask aside. The mask has to be covering nose and mouth and stay there firmly fitted. Otherwise, there's no point in wearing it. Certainly, she needs to be of a material that will keep it, that can be washable and keep its shape after being washed. So things that are made out of cotton or linen. It's important that people don't share masks. So if you're in a household, everybody should have their individual mask. It's really important if you're wearing a mask that you're not always adjusting. We don't want people to touch their face. So once the mask is on, you got to put it on properly and leave it there. And every time you touch your face, you're actually increasing the risk of maybe infecting yourself. So it's important to understand that masks can be helpful. But it's really important that people don't get a false sense of reassurance and say, well, if I'm wearing my mask, and forget to do all the other things like cough etiquette, like washing your hands, all the cleaning. Masks are part of a package of the personal preventive measures. Masks alone will not prevent the spread of the virus in our communities. The other way to use masks, and this is even more important, if people are sick, and we ask them to stay home if you're feeling unwell, but if you need to go out to see a healthcare provider, then it's very important that you wear a mask when you go into that healthcare environment. Right now, and ultimately how strong our recommendation is on masks depends on what the level of virus spread is. So in Nova Scotia, we're at right now that the public health position is that we certainly ask Nova Scotians to consider wearing a mask in places where they are around other people and social distancing cannot be maintained. You don't have to wear a mask when you're out and about in the outdoors and you're not around anybody outside of your household within 6 feet. But if you go to a grocery store and there's certainly the potential, or any other retail environment that you can't maintain that 6-foot distance, and especially when it's indoors, then those are places where you want to consider using a mask. If we get increased spread of our virus at some point down the future, we may actually have a stronger recommendation. But at this time, with the low levels of virus spread, we're asking Nova Scotians to consider using a mask in those specific environments. As we enter into our recovery, there may well be environments, whether it's a personal services environment, so you're going to get your nails done, or you're going to see health care, whether it's from a family doctor or a physiotherapist. They may actually, because of that close face-to-face encounter as they're providing care, we're certainly having expectations of the care providers wearing masks. They may actually require you to wear masks in some of those settings as well. So people need to understand and be prepared for certain settings. You may actually be asked to wear a mask. But in other settings, we encourage people to consider doing that with all the information that I've just outlined. On our coronavirus website has a whole section on masks. We would encourage people to go there, and there's a link to the federal government site around with even more detailed information on masks, including how to make homemade masks. So we need to continue to make choices that limit the opportunity for the virus to spread. That is part of our new normal. We're not going back. I've heard this weekend, I was rather frustrated. I heard lots of people saying, oh, the pandemic's over. Wave 1 is coming to an end. That's very different than the pandemic is over. So it's important that we continue to follow the public health rules even as we enter the recovery phase. Because if we don't, we're right back into the beginning that we were 2 months ago. So this is our new normal, and the new normal is very different from what it was in 2019. It's critically important that people understand that, and we all have to take our responsibility of how we continue to take the necessary steps that can continue to protect each other. Even as we enter into the recovery phase, all the environments we go out to are going to look very different from all the reasons I've outlined, but that is part of our new normal. It's important we start to understand that and recognize that and be prepared for that in the days and weeks to come.